The treatment of alcoholism involves a series of measures which indicates that, first of all, the patient needs to undergo detoxification therapy, remove toxins, and, so to speak, stop the effects of toxic substances on the body. So here we are talking about detoxification therapy. Naturally, alcoholics who have been consuming alcohol for a long time, especially those with chronic alcoholism, have a number of diseases that accompany the main condition, alcohol dependence. For this, we use symptomatic therapy, which eliminates pre-syndromic conditions and supports the function of the main organ systems, the heart, brain, liver, and kidneys. This is what we mean by symptomatic therapy. The most important and essential condition for treating alcoholism is inpatient treatment. In other words, this means complete isolation from alcohol. In order to bring a person back to their senses, so to speak, and return them to society, they need to undergo a course of inpatient treatment. Because outpatient treatment is not effective for someone who has been systematically consuming alcohol for a long time. It would be pointless, for example, to give someone a detox IV in the morning, send them home, and then have them go to a kiosk, buy at least a bottle of beer and drink it again. All of this, so to speak, is just a sham and will not result in any proper treatment. So the first and most important method is the complete isolation of the patient from alcoholic beverages. In other words, this means hospitalization. In addition to detoxification and metabolic therapy, we also provide psychotherapy, which is very important for patients. Psychologists and psychotherapists work with the patients because after treatment, after the physical withdrawal from alcohol, a person will need to return to the reality, to their life. There are various methods for treating alcoholism, such as hypnosis therapy, direct physical therapy, which involves administering an alcohol blocker, and long-term psychosocial therapy. There are also other treatment methods, such as certain physiotherapy procedures. But these are mostly used during the rehabilitation process. Hypnosis is a good thing, but it may work for some people and not for others. That's why our clinic uses the method of medical treatment for alcoholism, meaning the administration of an alcohol blocker followed by long-term rehabilitation in specialized rehabilitation centers where psychologists and psychotherapists work with patients. In the groups, individual sessions are held, both individual and, importantly, the principle of family psychodynamics is also applied. Because often, for the successful treatment of a patient with alcohol dependence, it is necessary for close friends and family members to get involved as well. Very often we encounter situations where, let's say, the patient does not want to go to the clinic for treatment, or is experiencing some problems at this stage, or the relatives are unable to reach him, and at the same time he is exhibiting a number of symptoms associated with alcohol withdrawal syndrome. In such cases, it is advisable before clinical intervention to first take some antiemetic medications such as Seroquel or metoclopramide. If the person has high blood pressure, it should be lowered with beta blocker medications. If they have a headache, various analgesics or antispasmodics can be used to prevent any manifestations of alcohol withdrawal symptoms at home. But again, I want to repeat that treating a disease like alcoholism at home is unrealistic and inappropriate. The only, let's say, acceptable option for home treatment is a one-time poisoning with alcohol surrogates. Yes, indeed, sometimes a person goes out to an event or birthday party, drinks a bit too much and ends up getting poisoned by low-quality alcohol. In such cases, it might make sense to call a doctor to your home. And the doctor will assess the situation on the spot, provide detoxification therapy, and prescribe medications that can be taken at home. And with that, let's say, the whole process will be finished. However, if a person is regularly and for a long time consuming alcohol, treating them at home is not advisable because this can lead to various complications and may require, so to speak, emergency resuscitation measures. to prevent all this and to avoid such outcomes, these conditions and this illness should only be treated in a hospital setting. It is ineffective to do this at home. And I repeat, the only effective option is in cases of poisoning, either by surrogates or, let's say, by low-quality alcoholic beverages. Only in this case is home treatment an option. In our clinic, we use all the necessary medications for the treatment of alcoholism. I'll just list the names of the groups. These are vitamin complexes, B group vitamins, which are essential in the treatment of alcoholism. These include benzodiazepine drugs, antipsychotics, and sedative medications used in the treatment of alcoholism. We also use the latest sorbents and sorbitals, which are used for detoxification therapy, as well as the newest regimen of antidepressants, which is necessary for patients who've overcome alcohol dependence.